Hey there, and welcome back to the Complicated Kids podcast. I'm your host, Gabrielle Nicolay. I am a toddler whisperer, a speech therapist, and a parent coach. And today I am joined by Seth Besse. Seth, welcome.
Hi, thanks for having me.
I want you to tell the good people a little bit about yourself, and then we will jump into what I think is going to be a really interesting conversation.
Yeah, great. So in some ways, I'm very new to this space. In other ways, I've been here my whole life. So I myself am dyslexic, have a diagnosis of ADHD, and kind of my whole childhood, I grew up wishing, or now looking back on it, wishing that my parents knew a little better what to do with me, kind of through education and everything, and that process. Kind of my background professionally has been in technology and operations. Largely, kind of the bulk of my career has been in legal tech. And kind of the one common thread throughout all of this is that I've found areas of what I like to call information asymmetry and built technology products to build transparency, right? And so very much I take kind of that lens to what we're doing with Undivided in this space.
And I love this so much because, first of all, I laughed before we hit record where you were like, talking to lawyers all day wasn't that much fun. Talking to the team at Undivided, which is the place where you now work and where you're applying your skills, was a lot more fun. It started as a passion project from actually, so we should full disclosure, Jason Lembeck, who is the founder of Undivided, is a mutual acquaintance of both of ours. And you were working for him for free for 6 months, yeah?
Yeah. So I worked with Jason for a little while I had kind of another legal tech product on the side. And obviously, with the legal tech product, that involved talking to lawyers all day, every day, right? And, while I can say we were working to solve an interesting problem, it wasn't a problem and a challenge that needed to be solved.
Yeah.
And lawyers are an interesting bunch to say the least. And talking to parents about kind of this space, what happens currently in this space, and kind of the lack of a coherent system and kind of information management in this space really was interesting to me. And so after kind of working with Jason on this on a conceptual level, I jumped in full time.
And we should define our terms here. So, Undivided is a company that does what?
Yeah, so at a super high level, how I like to describe it is we make sure that every parent of a child with an intellectual or developmental disability can answer three questions. First being, what should I do for my child? Second being, how do I do it? And third being, who can help me get it done? And really, it's that idea of taking all of the information that parents have learned and aggregated over the years and bringing that to kind of the next generation, the next set of parents that are facing those same challenges and having to navigate those same systems.
Part of the problem here in special education, particularly in the public school special education system, is because children are always graduating out, they're always just kind of progressing through. Parents, they have a steep learning curve when they start, and there is a little bit of rinse and repeat, but number one, development changes almost everything. So your skills are outdated as soon as you've acquired them. And then parents who are coming after you have to reinvent the wheel. And
Yep.
so some of this is, correct me if I'm wrong here, like making it so some people don't have to reinvent the wheel.
Yeah, that's the idea. I mean, when you think about a healthcare system, when you think about education, when you think about public benefits, you don't think about the best consumer experience, and you don't think about kind of the latest, greatest, cutting edge technology of how people interact with it, right? And so, and any of those things may be fine for someone that just needs to navigate the healthcare system or just needs to navigate public education. But when you have a family that needs to navigate all three of those at the same time, right? Naturally, obviously, we set them up with kind of the latest and greatest tech of a paper handout and a pat on the back, right? And that's not really a great way to help anyone through the process. I mean, you said it well. I often say that, parents spend weeks, months, years becoming an expert in something they're going to need to do once, right? And so every few years or every few months as a child's younger, and then every few years as a child gets older, there's some major transition, and that learning curve starts all over, and they're starting from scratch again.
And you said something interesting, and so I just want to put a case study with this, and we're going to make up a kid, but um, let's say kiddo has a developmental condition that also requires medical attention. Say they've got allergies. Say that there's a waiver available to fund some of the treatment. Did I hit all three of them? I think I did. And they go to a public school. Your Undivided helps integrate all of those systems. Is that what I'm hearing?
Yeah, we help parents understand where those systems come together, right? And really help parents organize that process. So to give you a little bit more information on what we do and how, we really start by building out a roadmap for families. And so that roadmap ideally would come as soon as a child gets a diagnosis or is working through getting an initial diagnosis. And that roadmap includes, okay, let's get your educational assessments. Let's get ready for your first IEP. Let's make sure that we understand the public benefits that are available. Let's find and help you build your team, whether it's speech, OT, PT, whatever your child needs. And if we can't find those in network, great. Let's make sure that you know how to file an out-of-network claim, when you would do that, when that's appropriate, when you might be able to apply for things like gap coverage or network insufficiency. All of those things, that's a lot of work for parents to understand and manage. So we build it all in a roadmap. And that's really kind of the what should I be doing for my child? Then the how do I do it really comes in the form of that roadmap is built into goals in our system. And each goal is a workspace, right? So a goal may be in California, for example, apply for regional center benefits, right? And so our goals have all of the resources and background information that parents need, the ability for parents to add documents to it so that they can add assessments, everything that they're going to need through that process. And then we have step-by-step guides that walk parents through the timeline, what they need to do next, the forms they need to submit, that whole process. And so
I'm overwhelmed as you're talking because of the amount of asymmetry, of information asymmetry. Like some of these are, I imagine, local programs, state programs, county programs, federal programs that are available to parents if they knew where to look, which they don't. And so aggregating, like, I'm just like, how do you aggregate all that information?
I mean, there's no central system right now for parents to do this, right? And so what ends up happening is you end up having silos, right? Where you have a social worker, you have a school counselor, you have a special ed director, you have a pediatrician over here, right? None of them are talking. And in many cases, none of them have gone through enough training on how to actually support the family to go deep with it, right? And so what ends up happening is they end up kind of not maliciously, but indirectly propagating a whole bunch of misunderstanding and misinformation, right? Where a lot of the parents that work with us have been told explicitly that they do not qualify for certain services or benefits, things like that. And they've gone 5, 10, even 15 years missing out on a number of things that would really benefit from their kids, really benefit their kids.
It's amazing. So, okay, we should be clear before we get any further because then people will be calling you saying, where can I find you in my state right now? What stage of development are you in at Undivided right now?
Yeah, right now we're focused on California. And so we have a few hundred families working with our navigators in California. Our navigators are all parents themselves of kids with disabilities. So they've navigated these systems for the benefit of their own families in the past. And then they've taken hundreds of other families through that process as well. And then we have thousands of families that are kind of on our platform and our free accounts, using the resources, using kind of the step-by-step guides to help themselves through it. But we're in California now. We're working on a few other states, building that process out.
Okay. And so if people do want to kind of track this, if you're interested in this approach, they can get on your list. I've been getting the emails. They're very helpful. There's tons of articles. There's lots of resources for people. Just on your platform for free. Yeah.
Yeah, on undivided.io, you can sign up for our newsletter. Obviously, our public benefits content and kind of the super local content is for California. The IEP content's written with California primarily in mind, yet the majority of it's, relevant countrywide.
Yeah. Do you want to give us like a case study or like a particular story of how a family came to you and what you did for them?
Yeah, for sure. Well, maybe I'll give a slightly more high-level story first. So, if we look in California, for example, right, there's a program called In-Home Support Services, IHSS, as most people know it, and that's a program to basically help parents pay for caregivers, and that caregiver can be themselves, and that's a program that's part of Medi-Cal. And so there's several layers of information that parents need to understand and navigate, right? So when a parent may qualify for IHSS, they need to figure out, okay, how do I get into regional center in California, right? And so they need to apply for regional center in California. There's a different process if their child's below age 3 than when they're 3 or above, right? And then once they're in regional center, they need to understand that they qualify for a Medi-Cal waiver, right? Which means that they can access Medi-Cal even if their household income's too high, right? Oftentimes they're not told that, right? And when they have really good private insurance, why would they need Medi-Cal, right? Well, there's a whole number of reasons that you can use where you can use Medi-Cal as secondary insurance, where you can access programs like IHSS, right?
And by the way, I do know of several states that have corollaries to what you're talking about. So this will track across states. So I just wanted to throw that in here so that, if you're listening in a state other than California and you think, oh, I don't know, no, it exists.
Yeah.
Not everywhere, but in some places.
So many states have these same, the
Yeah.
acronym changed slightly, but the concept is very similar.
Yeah.
And then they need to understand and know what IHSS is, right? And there's really no one that's marching parents through that whole process. And then once they understand IHSS, they need to apply for it. They need to figure out how they themselves, if they left the workforce, can become a parent provider in IHSS, right? And we know, that around 30% of parents of kids with disabilities leave the workforce, right? So this is a major opportunity for parents to get paid to be full-time caregivers. And then they apply for IHSS and they go through that whole process, right? And this matters because that program alone, and there's dozens of programs like that just in California, for example, that program alone can be worth up to $60,000 a year for families, right? So that's a life-changing program, but no one really helps parents through that whole process. So to kind of give a more specific example of how we do that and how we get started, when parents first come into us, we match them up with a navigator. And again, our navigators are all parents themselves. And so that navigator gets to know the family over a series of Zoom calls just like this, where they kind of understand where the family's at, what's working well for their child, what's not working well for their child. And that navigator works with the family to build a roadmap, right? And so we have a system that helps build that through the software, and then the navigator kind of curates it specifically for the family. And as those goals get built into that roadmap, the navigator adds additional info. Our system knows, what's relevant, what's not, and brings that information in. And then the navigator will work with the parent the whole way along to get those things done. So in that last example, right, if a parent just got a diagnosis and they qualify for regional center, the navigator will help them understand, okay, here's the information that we need to apply for regional center. I'm adding a task for you in that goal to upload this document, to get all this paperwork ready, and then we're going to go ahead and submit it. Once we have that done, then we'll look at the menu of services from regional center, and we'll help you identify what you should be ready to go in and ask for, so that you're not kind of at the mercy of regional centers saying, here you go, right?
This is something that parents of kids with needs, parents of complicated kids, get to learn early and often, which is no one is going to give you anything. And I'm being a little bit stark for a fact here, but advocating on behalf of your child is a skill that is required when you have a complicated kid, because again, these systems they're very well intended, but because they're government bureaucracies, most of them, they're labyrinthine, they're hard to navigate, they're not created with the user in mind. And again, you might come up against a menu and they're going to give you, the top two lines, and the whole menu is available to you if you knew to ask for it.
Yep. But they don't give you the menu is the important part, right? So it's
right. There is no menu. Yeah.
It's a little bit, the analogy that I've used many times is it's like asking parents to file their taxes, but only giving them the tax code and saying best of luck, right? Not having TurboTax, not having an accountant, right? Needing to go through this and figure out what is available, why it's there, how to do it, and go through that whole process, right? And that concept needs to change in the same way that, in California, for example, parents don't need to sign off an entire IEP, right? They can sign off on the areas of the IEP that they agree with. No one at a school is ever going to tell a parent that, right?
No, because they want you to sign the whole IEP. It makes their life easier, and they have too much to do. And again, no shade to any to any administrator, to any special educator. They have too much to do. We know this, and they're underpaid for it. But they're not going to tell you that.
And so the idea is we're really trying to flip that so that parents go in with that information, knowing what to ask for, knowing what they're entitled to, so that the script gets flipped a little bit. And so just to kind of speed up that process so that parents can get, I won't say get it the first time, but get it closer to the first time than they do currently, where it typically takes years for them to learn those mistakes and then.
Yeah. Yeah. I liked your analogy about TurboTax. This is like TurboTax for special education.
Yeah, my product designer hates that analogy, but yes, that is the idea. I mean, that is effectively what we're working on building, is helping parents navigate through these systems of bureaucratic or other to kind of get their kids the support they need. And really, we have a focus of making sure that families get the foundation set up. Because, you look at every child's needs, they're incredibly unique, right? But you look at the support systems that are in place to help parents, they're not all that unique, right? So many parents have the same foundational layer that they have to set up.
Yeah.
The problem is that foundational layer, it may only take care of 10% of your child's needs, but it takes years to set up, right? And so we're trying to make that foundational layer much easier to set up so that parents can really focus on the things that are really unique to themselves, their family, the like. And the same way, there's all of these amazing community organizations that have sprung up that are hyper local to really help parents in a specific school district, in a specific county, right? And we want those people to be able to focus on the hyper local, hyper specific stuff while we work with the parents to get the foundation set up.
I love that. I interviewed somebody at Moms in Motion. Anna Thomas came on the podcast. So if you're interested and you're in Virginia, they are a service that helps families in Virginia do exactly what you're talking about here. Access local and state funds for caregiving for kids who are complicated. Who pays for all of this layer of support?
Yeah. So right now, parents are paying directly. And we're still a relatively new company. And the reason that we're doing it that way is we want to make sure that our incentives are fully aligned with parents. There's been too many kind of systems in this space that don't get enough adoption, because as soon as you kind of split in technology speak, as soon as you split your customer and your user, incentives aren't fully aligned, right? And so when you think of ad supported programs and things like that, that's obviously splitting the user and the customer. And so we really wanted to start with making sure that that is perfectly aligned. So we're building a service that's truly going to move parents forward, not just the idea of a service, right? So that we get adoption, we make sure that parents month after month after month are finding enough value to continue working through it.
Yeah.
That said, what we're working on now is a number of different payment avenues that parents can use. So for example, in California right now, there's a self-determination program available through the regional center. And so parents are able to pay for undivided membership through self-determination in many cases. And then we're working with a few large employers to potentially cover this as an employee benefit. And then we have a few pilots going with large payers, right, where this would be a benefit for membership in a Kaiser, so on and so forth.
Got it. Okay. So, right. So this becomes sort of part of another set of benefits that you receive, either through work or through wherever the thing happens to be.
And that said, what we're trying to do, and hopefully what'll be largely released later this summer, is a software first, really software only platform that pulls the navigator out of it. And really that allows us to offer this at a very, very inexpensive rate that, every family kind of going through this, whether they're paying for it out of pocket or regional center or other is paying for it, it's a no-brainer to get those parents into that central system. And the beauty, the more parents that we get on this platform, the more we learn, right? And so as we see parents working through these goals, working through these challenges, our navigators are documenting that. We're hearing feedback from families of, hey, step 5 of this guide didn't work for me, and here's why. Right. And that's what educates our content, educates our information, and builds that collective knowledge.
It's so inspiring to me that that you all have taken this on, because there are so many factors that are working against you. I don't have to tell you, but I'll tell the audience, right? Children don't have income, they don't vote, they don't have a voice. And then parents are busy trying to have a job, trying to raise complicated kids who make them take a lot of time off work. And so they're certainly not going to the government agencies, for example, to say, hey, step 5 really doesn't work for me. And so the fact that you all are stepping into this space in a meaningful way, that's again back to this information asymmetry problem, not even question, but problem, I find it very inspiring.
Yeah, well, it's an interesting, I mean, there's so many ways to kind of try and solve this problem. And when you think about bureaucratic systems that have a process, right? If you're on the other side of the desk, being the person that needs to understand those applications, approve those applications, things like that, it's much easier if those applications are all filled out the same way, right? It's really difficult if people who are all self-taught are filling those things out different ways, sending information at different times. It's much easier to get one system in. So really all we're trying to do, and our focus here, is to flip it so that the information comes in and is easier to get through that system, so more families can get through that system and learn.
I had not thought of it that way. That is so interesting. You're making the bureaucrat's job easier because you're standardizing the front end of that. That's what you're saying, yeah?
Yeah. And it's really, when you think about any job, any position, right? The learning that, what we call in the tech space, the happy path, when everything goes right, learning that happy path is easy and quick. It's learning the edge cases and the outliers that takes forever. Right. And so, a lot of what we have in special education and in public benefits and everything is dealing with the little outliers that sometimes need to exist, but sometimes don't, right? And so just that basic education, if we can take some of those outliers, limit them to really only when they need to exist, we can streamline the whole process.
I love this so much, not least because everybody thinks they're so special, including me. And really, there are some things about all humans, for example, that are just the same. And so, we're all unique and none of us is actually that special. So it's a both and.
We're all unique, and a lot of us are quite special in our own ways, but the systems that we need to navigate, at some point, there's a gating function that makes it one way through, right? And so that gets rid of all that uniqueness and crams it through one little pathway, right? And so ultimately, what we're working on is figuring out how to do that process efficiently.
Yeah. Yeah. And it sounds like with the actual users in mind. And so that's, I think, what differentiates you. And of course, you would have to do this because we were talking about children.
It'll never work without taking a user-centric approach.
Yeah.
It just doesn't, right? Parents need to be incented to adopt a system that helps the process.
Yeah.
And if customers are separated from users, that's really hard. If your users don't see value in minute one, really hard, right? And especially when we're dealing with and talking about parents that are extremely overwhelmed because they do have to navigate all these systems. They may be a new parent, they're figuring out all this on their own, they're figuring it out at midnight or 2 a.m. And so we need to just streamline that whole process for everyone.
Yeah. If people want to learn more about Undivided and the work you do, what do they do?
Yeah. So come to undivided.io, Google Undivided, however you want to find us. We have a newsletter that goes out once a week where we put a whole bunch of useful articles, whether timely or what we're seeing kind of trend wise out there. And then anyone in California with a child under 18, we'd love to kind of bring you in through our process. And we do, right now we're doing what we call kickstarts, which are a free process where we match you up with a navigator and they build that roadmap for you. You can kind of see what we're all about before committing to anything.
I love it. And plans to maybe expand into other states coming.
Yeah, we are working right now on a few different states, and so we'll see where that ends up. But we do want to hear, and as parents sign up in different states, please let us know kind of priorities and areas, because it would be great to as our system grows and our knowledge grows by having users,
Yeah.
right? So we want to kind of the next states we launch in, we need to have kind of a core set of users to really start growing that knowledge.
I love it. I love it. Seth, thank you so much for coming, for educating us. It was really great to talk to you. Thank you.
Yeah, great to talk to you as well.